At each step as we go to it, we've now developed clinical skills, competencies, and milestones to inform you of the skill level we expect you to have now and to work on between now and your next advanced practice module, and the skill level we'll expect for you at certification. It's on the model of 4 milestones. The first 3 milestones you work on between now and your next advanced practice module. The 4th milestone is the skill level we expect for certification. So you can see here, milestone 1, work on gathering yourself before each patient visit. And then can you consistently and effectively use the intake tools, the diet, nutrition, lifestyle journal, the medical symptom questionnaire. Milestone 3, can you accurately document and populate the timeline and matrix with the antecedents, triggers, mediators, modifiable lifestyle factors, mental, emotional factors, and those current concerns down on the white part of the timeline. Moving away from the gather step, the organize step. This is the O step. 2nd and 4th steps, the O steps where we use the matrix the most. So in the gather step, we identified physiological dysfunction. In the organize step, we're going to now think about how the physiological dysfunction can be reversed. And that's negative language. To put it into positive language, how can we restore normal and optimal physiological function? And then, of course, this organize step is done to facilitate the next 2 steps. We're organizing on the matrix to tell a better patient story. We're organizing on the matrix to inform how we're going to order and prioritize with them. To do this, we're going to have to look at antecedents, triggers, and mediators again, and from a little bit of different perspective to give you some different insights into it from what you've learned thus far in the course. And we're going to correlate all of this to how it can help the patient reverse physiological dysfunction. Antecedents, triggers, and mediators. Antecedents come in 2 kinds, inherited and acquired. Helen's inherited antecedents, like everybody else, would be her family history. And these would have a delayed effect, again, being contributory to the likelihood she would develop those conditions in the future. Now, we think of inherited antecedents as unchangeable. After this course, after this training, you should now understand inherited antecedents can be mitigated with epigenetic interventions. What epigenetic interventions have you learned in this course? Monique, think Monique. Stress reduction changes genetic expression. Nutrition changes genetic expression. You can mitigate inherited antecedents. Monday, September 23rd. Acquired antecedents. What's the difference between an antecedent and a trigger? An antecedent is a trigger with a delayed effect. A trigger causes an effect immediately. An antecedent can cause an effect, but it's delayed. So, Helen's acquired antecedents include her poor nutrition. As soon as you start eating an American diet, you don't develop problems, but if you eat it long enough, it has that delayed effect and you will start to have physiological problems. Chronic low-grade stress, not a trigger for most people, but an antecedent, because it takes time for that chronic low-grade stress to have its physiological effect. Sudden acute stress, trigger. Chronic low-grade stress, antecedent. And acquired antecedents, if they persist long enough until the person manifests the disease, they then become mediators. So antecedents become mediators if they're not addressed. Now, you can attenuate acquired antecedents with lifestyle, nutrition, and behavior interventions. Those are your key go-to. It's food first and the modifiable lifestyle factors. So how about triggers? Triggers come in 3 kinds, basically. They have an immediate effect. There's life events, precipitating life events. I was never the same since. And then there's environmental triggers. So environmental triggers, like pollen, cigarette smoke, you can help a patient avoid those. We've all learned that. What about triggers like food? If we change conditions, that trigger might no longer be a trigger. Think about the permeable intestine. You now have learned how to change the permeable intestine. If you change that condition, change the patient's environment, that food will no longer be a trigger. And then adverse life events, response to life events. You cannot change the fact that that life event occurred, but can you change the patient's response to that life event? Or can you refer them to a qualified professional who can help them change their response to that? That can be life-altering, physiologic-altering. Okay, Helen's triggering life events, certainly her divorce. I was never the same since my divorce. That's when X, Y, and Z happened. Mediators. Mediators can be biochemical or biopsychosocial. They perpetuate dysfunction. They usually come in the form of excess or deficiency, so the key to that is to increase, reduce, omit, or eliminate. And if you think about it, every lifestyle factor, when it's not good, is a mediator of dysfunction. And therefore, every modifiable lifestyle factor is a tool you can use to improve physiological dysfunction. Mediators of excess in Helen, it's her carbohydrates, it's her processed food. Mediator of deficiency in Helen, if we don't address her inadequate sleep, it will be difficult to optimize her physiological dysfunction. And the modifiable lifestyle factors influence function because if we change them, if we change the conditions of a patient's life, we can help them restore their function. Behavior informs function. We talked yesterday about environment determines function. The patient's behavior is part of their current environment. And mental, emotional, spiritual factors change physiology as well. With Helen, it's her depressed mood. You can help her change that. And I like to say we always think of the MESs as MES. The mental, emotional, spiritual factors, we think of them as immutable. But I say they are malleable existential sacralities. There's something for you to look up. If you look it up, you'll remember it better. But they alter physiology, and they can contribute to reversing physiological dysfunction. If you can help a patient change their mood and their emotional state, you've already learned how to do that in this course. And also their connections and their spirituality. That can be done. You can change their physiology that way. At this point in my training, I was also a bit overwhelmed by the thought of these features of the patient's life can go in so many different places on the matrix. And so yes, they can have dual citizenship or triple citizenship. We want to reinforce that. You can put these on many different places on the matrix. Some features of the patient's life might go in all 4 areas. There will be overlap. So that the antecedents, triggers, and mediators, we've already said antecedents can become mediators if they're not addressed. Any antecedent, trigger, or mediator could be a modifiable lifestyle factor, especially those mediators. They can be mental, emotional, spiritual factors. They could be also populated on any of the 7 nodes of the matrix. All of the modifiable lifestyle factors are mediators, and they can be populated there or as mental, emotional, spiritual factors, especially the relationship and stress behaviors, in any of the 7 nodes of the matrix. And any of the mental, emotional, spiritual factors can be populated on one of the 7 nodes of the matrix as mediators, antecedents, triggers, or lifestyle factors. So this didn't answer my question. This just overwhelmed me more. And I said, well, what's the right way to populate the matrix then? There's no way I'll ever get it. Why are we organizing? To inform the next 2 steps. We're organizing to tell the patient their story in the best way we can. So there's no right way or wrong way to populate the matrix. The right way for me to populate the matrix is the way that helps me tell the patient their story the best way that I can. And the way that helps me order and prioritize interventions with them the best way I can, according to the skills I have and the tools I have. So we're populating the matrix to inform those next 2 steps. Keep that in mind, take a deep breath, relax, go forth with confidence on your matrix. That's why you're doing it. You don't have to get it right. There is no right. There's my way, which is right for me, and there's your way, which is right for you based on how you're going to tell the story. What kind of interventions you can use. So let's look at each node of the matrix, that part that I said you don't have to master yet, and just give you some teasers going forward. A new wrinkle, ways to think about each function there in those 7 nodes so that you have new insights. Let's put these together, see how they're related to each other. And if you think about them as functions of the body, and what needs to be moved around the body, and where it needs to be moved, what it needs to be moved across and around. Biotransformation and elimination. That moves things from inside the body to outside the body. The assimilation node, that's all about moving things from outside the body to inside the body, across barriers and membranes, most prominently the gut epithelial membrane. The transport node, that is the internal to internal movement of substances across those barriers and membranes. The communication node is what gets moved. It's the hormones, it's the neurotransmitters, the information when they're successfully moved across barriers and membranes. And then what's structural integrity all about? That's the health of the barriers and membranes. That keeps things where they should be and keeps things out that should not be there. And it's the barriers across which this information must pass. They have to be healthy. And what is the defense and repair node about? That repairs the structures and the barriers and helps defend us against the things that shouldn't cross those barriers. And how about the energy node that you just learned about? That's the molecular currency that funds the functions of all of this. And the mental, emotional, spiritual factors are like the bioenergetic Wi-Fi that runs it all, because they will inform the competence of all these functions. Upstream medicine, you've heard about this. So again, take a deep breath and go at the matrix with confidence. If we're going to address the same means to treat the disease as that which caused the disease, we want to go upstream. Where is upstream on the matrix? Have you thought about that yet? Upstream on the matrix is here. The ATMs and the modifiable lifestyle factors and the mental, emotional, spiritual factors. We also populate effects and consequences of disease on the 7 nodes of the matrix. That's not the most upstream. When you go forth in your practice now, you can just focus on the ATMs, the MLFs, and the mental, emotional, spiritual factors. They are more upstream. We'll reinforce this later in the presentation. So in the organized step, you're going to focus on that matrix, especially the ATMs and the MLFs. You're going to filter it through now your systems biology thinking to get at physiological dysfunction. That's your holy grail. How does this relate to the original definition of evidence-based medicine? The way you organize on the matrix, when you do it effectively, augments your clinical judgment. So the timeline amplifies your clinical experience. The matrix augments your clinical judgment, drawing evidence from the patient to help you make better clinical decisions to get better outcomes. So you're going to be able to think about reversing physiological dysfunction in this organized step, and it's going to inform you how to tell your story and order and prioritize. Skill level we expect you to have with this. Here we are. Your competencies and milestones. Focus on the third one. We're going to expect you to really start working on populating the matrix with factors that contribute to, correlate, or are causative of dysfunction on the 7 nodes of the matrix. You can go forward without even worrying about the 7 nodes of the matrix right now. So confidence, you can do this. Next step, third step of go to it, telling the patient their story. And as you guessed it, this is to inform how you're going to orderize and prioritize with the patient. First step and third step, you need the timeline. And the difference between showing the patient the timeline when you're telling them their story and not showing it to them is significant. It has a huge impact. Nobody has ever taken the care to learn this patient's story the way you have it. And using the timeline and showing it to them makes that impact even greater. So what are the tools that are not in the toolkit? Very important tools in this step. This description emphasizes it's a dialogue. It's not you telling them their story. It's you telling them their story and asking for corrections. It's a back and forth until you get it right. And correlating. See the word correlating. You need to correlate their life events to their current concerns and issues. That's part of telling the story. So the way I used to tell the story, as I said, is you have this diagnosis. But that's a monad. That's me alone. What we want to do is make this a dyad. I want to say, Helen, I'd like to tell you your story, and I'd like you to correct what I didn't get right. So telling the story is about connection and correction. Helen, you're expressing these conditions, and Helen will want to know, why am I expressing these conditions? Because of these antecedents, triggers, and mediators. Because of these modifiable lifestyle factors. Because of these mental, emotional, spiritual factors. You have to make the correlations for the patient. And the positive language then, if you change some conditions in your life, these conditions can change and you can feel better. And this is how you tell a story to give the patient hope, to motivate them. That contributes to better outcomes. The patient will now ask, how? How can I make these changes? you've got a therapeutic partnership. How? And I would argue that you do not want to proceed to the order and prioritize step until you've got a motivated, activated patient. So an important skill as part of this storytelling is to take the causes in the antecedents, triggers, mediators area of the timeline and correlate to them to the effects for the patient, as well as to the current conditions they're experiencing, which you've populated on the right-hand side of the matrix. This is what you can start to practice now as you go forward on Monday. So, with this in mind, are you ready to tell Helen her story? This is how I would tell Helen her story, and it's different from how you will. Helen, thank you for sharing your story with me. That really took some courage because we're just getting to know each other. And from your story, I can tell you've been through a lot. You've really suffered. I can also tell you are really strong. When I think of the challenges you've been through and what you've overcome and the strengths you have drawn upon to get through those and the strengths you're probably still drawing upon, that really impresses me. And I am so hopeful and confident that you're going to be able to draw on some of those strengths to do some of the things you need to do to feel quite a lot better. And with that in mind, I'd like to tell you your story now as I understand it. And when I finish the story, I want you to correct anything I didn't understand. What I'm going to do is use stars. Anytime there's a yellow star, I'm going to talk about something called inflammation. Anytime there's a green star, I'm going to talk about something called the gut microbiota or the bacteria in your gut. And anytime I put a purple star on the paper, I'm going to talk about inflammation, and I'll explain these as we go along. In your family history, you had conditions of inflammation, which predisposed you, made it more likely that you were going to get these kinds of conditions in your future, and you have. You've got some inflammatory conditions now. When your mother was pregnant with you, she didn't have a very good diet and she smoked a lot. Those are inflammatory conditions. At the time she was pregnant with you, we didn't even know that. So we're not blaming her. It's just that also contributed to setting you up for a lot of inflammation in your life, made it more likely that you were going to get some of the conditions you're experiencing now. And I want to turn to those bacteria in the gut that we talked about. The best way to get the best bacteria in your gut or your intestine is to be born through the birth canal and then to be breastfed. And on the day of birth, you were born by C-section, then you were bottle fed. So you just happen not to get the best bacteria in your intestine. And the bacteria in our intestines actually help control inflammation. So this could contribute to further inflammation and more inflammatory conditions in your life. And these good bacteria cannot survive antibiotics. So the colic that you had would pretty much tell me that you had some problems with your intestine, even in your first year of life. And then the antibiotics that you got for the ear infections were good for your ear infections, but those antibiotics can kill the good bacteria. And that sets you up for further problems with your gut, further problems with inflammation. You had irritable bowel syndrome, abdominal pain by the time you were 7. That kind of confirms to me that you really did have some pretty significant problems in the intestines, even before you got to be 10 years old. You got more antibiotics for acne. Your acne was severe. Your periods were really painful. That's associated with inflammation. I think even before you became an adult, Helen, that there was some severe problems with inflammation and your gut going even before you reached adulthood. The good thing about this, though, is the intestines, one of the easiest things to fix or to repair in the body. I know you can do it. And when you improve your intestine, you improve inflammation. If you can improve inflammation, you'll improve the health of your intestine. So these are interrelated, and I'm really hopeful you'll be able to make some changes to improve both of those, even though they're probably contributing to some of your problems. In your 20s, you had 3 children within 4 years. You got really tired, and you told me all about that. We talked about all the possible causes of that, nutrients, pregnancies, taking care of children, thyroid, depression, all those problems we talked about. What we didn't discover is 5 years later, you started developing chemical sensitivities. That's highly correlated with a toxic exposure. And when I was gathering your story, I couldn't detect any kind of a toxic exposure you might have had. So what I'm going to do is give you a questionnaire. It's called a toxic exposure questionnaire. This is your assignment before the next appointment. I want you to fill that out. Let's see if we can find what toxic exposure you might have had. That might be a clue to helping you get better as well. And then the last 20 years of your life, that's where the major theme goes from the gut and inflammation and turns to stress. So you got a master's degree in nursing while you're taking care of 3 children. Well, you've got some strength. That's stress, though. And when we have stress, in the short term, it's a good thing. It helps us handle problems and keeps our physiology, our functions going. When we have chronic stress over a long time, we produce something called cortisol, a stress hormone. That can damage our tissues, that can run us down and wear us out and cause some of the symptoms you've currently got. So after that master's degree, you started taking care of your mother. She was dying of cancer. We talked about the stress of that. You told me how that affected your health. You then went through a divorce. Yeah, I know your health was never the same since then. You became a single mother of 3 children. And you got big, powerful, jobs with high responsibility and some stressful job changes. All of this contributed to about 20 years of constant stress hormone. That took a toll on your body, Helen. And that stress hormone is actually causative of all 5 things you told me about. It can cause depression. It can cause headaches. It can cause trouble sleeping. It can cause memory loss, or brain fog, as you called it. It can cause you to not be able to lose that weight. And then if we go back to your earlier life, and that inflammation and the gut problems I thought were a problem before you were an adult, I think they and your family history contributed to these current diagnoses you have, the cholesterol, the blood pressure, the low thyroid function, and that autoimmune thyroid problem. That's gut and inflammation both. So this is your health story as I understand it, Helen. And the good news is all of these are interrelated. If you can do anything to avoid stress, change your stress levels, that helps your gut be better. That lowers your inflammation. If you lower inflammation, your gut function becomes better. If you can improve any aspect of your gut, and I can help you, you're going to lower your inflammation, and it's actually going to help your stress. So I'm really hopeful we can do this together, and I know from the strengths that you've shown already that you'll be able to make some of these changes. So before we talk about what changes you might want to make first tell me, did I get your story right? And correct anything I didn't have right so we can go forward and make the right changes. So that's Helen's first. Thank you. That is Helen's first therapeutic intervention. She's been understood, and if I'm showing her the timeline, it's even more powerful. So the tell step is to prepare us now. I have a motivated patient, an activated patient. She's ready to order and prioritize together with me, because that's what the tell step is about, to prepare you both to go forward and order and prioritize. Because, and you also want to remember, align those causes in her timeline, the ATMs, the MESs, the modifiable lifestyle factors, with the current effects. Because remember, you can mitigate the antecedents epigenetically. You can change her environment and help her change her mindset. You can help her increase what's deficient and decrease what's in excess. How you tell that story will help you get better outcomes. So we're going to have you stand up again and do a little workshop together. Pick a partner now. And we're not going to tell the whole story, but this is the most important skill, so we want you to practice. Here's your assignment. Pick a partner, and one of you is the doctor, one of you is the patient. For the first minute, the doctor explains to Helen how her family history and prenatal exposure predisposed her to her current conditions. After a minute, switch partners, and then explain how Helen's current conditions are correlated with her story from the day of birth, that C-section, through the first 5 years of her life, the bottle feeding and the antibiotics especially.